Hi, welcome to IANS Health Talk with Dr. Akram. I am Akram. In this program, we will be talking about all kind of different health issues with different experts in the field. Today, we will be talking about pain. So sit back, relax, enjoy your time with us. In 1812, the eminent novelist Frances Burney lay down on a bed in her Parisian drawing room, spread a cambric handkerchief over her face and underwent a mastectomy. She was not given any anesthetic. In a letter to her sister later, she described enduring the most torturing pain when the dreadful steel was plunged into the breast, cutting through veins, arteries, flesh, nerves. She wrote, "I needed no injunctions not to restrain my cries. I began to scream that lasted intermittently during the whole time of the incident." Pain. Pain is a distressing feeling often caused by intense or damaging stimuli. In medical diagnosis, pain is regarded as a symptom of underlying condition. Most pain resolves once the noxious stimuli is removed and the body has healed, but it may persist despite removal of the stimulus and apparent healing of the body. Sometimes pain arises in the absence of any detectable stimuli, damage, or disease. Pain is the most common reason for physician consultation in most developed countries. It is a major symptom in many medical conditions and can interfere with a person's quality of life and general functioning. Let's look at the history. Before the relatively recent discovery of neurons and their role in pain, various different body functions were proposed to account for pain. There were several competing early theories of pain among the ancient Greeks. Hippocrates believed that it was due to an imbalance in vital fluids. The 11th century Avicenna theorized that there were a number of feeling senses, including touch, pain. Even history reports that pain is considered as a taboo and it's given to individuals as a punishment by the god. Several epidemiological studies have reported widely varying prevalence rates of chronic pain ranging from 12 to 80% of the population. It becomes more common as people approach death. A study of 4,700 patients found that 26% had pain in the last 2 years of life, increasing to 46% in the last month. Let's look at two types of pain. Acute pain. This is a type of pain is generally intense and short-lived. It is how the body alerts a person to an injury or localized tissue damage. Treating the underlying injury usually resolves the acute pain. But chronic pain is a type of pain that lasts for longer than acute pain, and there is often no cure. Chronic pain can be mild or severe. It can also be either continuous, such as arthritis, or intermittent, as with migraines. Okay, before we go more into the details about pain, let's welcome our special guest, who is a pain consultant working in Chelmsford, Essex. He has been working as a chronic pain consultant for 11 years. He works for NHS and also in private sector. One of his main interests is vitamin D and its contribution to various bodily functions. Let's welcome our special guest, Dr. Subodha Thantulage. Subodha, welcome to the program.
Thank you very much, Akram, for inviting me for the second time. I'm privileged to be here. Thank you.
It's nice to have you back here again. And today we're going to talk an important subject, pain. Pain is very common, Subodha, but I think sometimes I feel like it's hardly understood as well.
Now, when you're talking about the pain, Akram, as you said, pain is bad. When you think about the pain, it gives grievances as well as bad feelings. But when you think about the pain, is far beyond that what we normally know. Normally we day to day describe pain through our own experiences or what we have seen. But if you think this way, I'm going to say, or I'm going to describe some of the good thing about the pain. Now, if you are a normal human being, you will feel some degree of pain. On day-to-day life, we all feel pain. We all generate, our body generate pain. But fortunately, we don't feel that pain. Now, we'll think this way. Some of us like very heavy metallic music. Some of us are not like them. According to our description of pain, any abnormal sensation which can make you annoying or unpleasant, we describe them as a pain.
Pain.
No, pain.
Okay, so I'm going to hold you there. I'm going to pass a message. This is a live program, so call us on 0203 515 5788 if you have any questions or suggestions, or write to us healthtalk@iontv.co.uk, and you can also follow us on Twitter and Facebook, Iron Health Talk with Dr. Akram, and of course you can watch us on Facebook Live, iontv.co.uk. Okay, let's go back to the subject.
Now, if you think about the example of listening to music, now some people like it, some type of music, some people doesn't like it. And on normal in society we say, don't be pain in your neck, or don't be my back pain. That because any annoyance considers as pain. Now when you're going back to music, some people like it, some people doesn't like it. So if you go to any rock cafe, heavy thundery music could be painful for years. So it's painful.
So that's also considered as pain.
As pain. And the other thing, by doing that, it allows you to choose your path, whether what you like or not. So it allows, that means pain or unpleasant sensation allows you to modify yourself what you like. And let's look at some other example. If you think about as a child, if he or she as a baby put a finger on a hot subject, they will understand this is hot. You shouldn't be doing that, it is a danger. And also you will see if you fall and got injured, it causes pain. Therefore, at a little as 1 year, or when you started to understand, we will understand what the pain is about.
Today we are talking about pain, which is an important subject, and we have our specialist or chronic pain consultant, Dr. Subodha Tampilage. Welcome back, Subodha, again. And we've been talking about what is pain.
What is pain?
Yeah.
Yes, thank you very much again. Now we talk about all about bad things about the pain. That's a normal experience. I'm going to talk I'm going to say what is good about pain. So we talk about early life. Any child get used to and understand what is danger or what is good, and also people get understand what is good or bad in their social environment. And also, if you think about the pain is something like essential component of human body. Now, if you think about thirst, hunger, those are essential requirements to survive. The same applies to the pain, and pain is one of the essential components in human experience to shape their way on their lifetime.
So you're trying to say the pain has been evolved with us for over the generations, isn't it?
Pain, without the pain, if you're trying to be without the pain, you are putting yourself to harm. Now think about this way.
1 minute, Subodha. There is a caller online, and let's join the caller as well. Hello.
Hello, Assalamu alaikum.
Wa alaikum assalam, bhai. What's your name, please?
My name is Mohammed Ahmed.
Mohammed, thank you very much for calling us. Before you ask a question, I'm going to let my guest to finish what he was talking, and
okay,
you can
no
just be on the line, and
okay.
Once we finish the sentence, we'll come back to you quickly. All right?
Okay.
Thank you very much. Just be on the line. We can hear you, and you can hear us as well.
Okay.
Now,
yes.
And the other thing is, it's an essential part of body. Think about somebody who doesn't feel pain. If you are sleeping close to a radiator, if you don't feel pain, you're going to burn yourself.
That's true.
If you fall off, if you don't feel pain, you get injured. So therefore, pain is one of the essential component in the body.
So you are trying to say that pain is not the bad guy there, I say?
Is not at all. But and also this feeling or description of pain, what we tell about pain, it depends on myself or yourself, Akram. It's different. What I perceive as pain, what I analyze, understand as a pain may be different to yours.
Excellent.
Now that is why how we understand about the pain, it depends on how you brought up in your life, what you've been explained during your childhood, whatever childhood did you have, and also what is your education, what you understand. All these components enable you to understand, describe your feeling of pain. That's why it's always, we call it subjective. That means it's different from one person to the other.
And it's quite complex as well.
It is very complex. Normally, how we feel pain, we all have 5 senses. We have eyes, ears, mouth, and nose, and also feelings on when we touch. Now, all these feelings get the information into your brain. Now, normal understanding, when we think about the pain, we experience pain when you get injured or when we get any other symptom which is not used to us. Suddenly you get pain, then because you explained, some of the doctors as well as a normal human being explained and experienced, once the actual pain comes, there will be harm. But why is this happen? Normally on day-to-day life, we normally have anything what we do, we touch like this, we slap, we jump, we generate pain. But fortunately, when we get the information through our skin, through the tissues and the nerve system, it should come to the brain, which is a huge computer. Now the body is, if you think about the body, you have a cells, and you have trillions and trillions of cells. They all can feel some degree of pain, and they transfer this information to your brain through nervous system and through chemicals.
Okay.
Now, if you are a normal human being having no other pathological conditions or no other disease, your normal pain which you generate on day-to-day life will obstruct through up to your way to the brain. That means before you feel your pain, it has been stopped due to various chemicals and various nerve functions. But when it becomes abnormal, you can feel more pain. For example, if you get normal flu, you might feel back pain. And if you get any infection, you may feel pain, which you normally generate yourself. And that because that mechanism which involved to control your normal pain could be affected by any disease.
Okay, so Bodha, I'm going to ask our caller, Mr. Muhammad, are you still on the line? Sorry, we had to keep you there. Okay, sir. We're going to let you go ahead with your question or suggestion, and then we'll continue our discussion.
I'd like to ask you something about the shoulder pain.
Okay, sir, go ahead,
because I got diabetes myself, and last 3 months I got frozen shoulder, and I take some medicine, hydrochloric tablet or naproxen and some paracetamol also, but doesn't work. And then I call for my GP, and they referred me to private hospital. Can you hear me?
Yes, we are listening to you. Yes.
Yeah, and then I make an appointment with them, and they arrange for me one of the injection.
Okay.
And once when I've been in Albion Hospital in Aberdeen, I'm calling from Scotland, and then they said it could be side effect when they put the injection, and they numb one of the anesthesia one of my left hand, and they push the injection. After 2 days, I feel my voice is a little bit down, and I'm very weak still. Could you please help me? What shall I do now?
Okay, let me summarize what you said. You said you have frozen shoulder.
Yes.
And you called your GP, and he referred to a hospital somewhere, and they had put an injection. Is that right?
Steroid injection.
Okay.
Steroid.
after that injection, do you still feel that numbness, or is the numbness started?
No, numb is gone, but I feel very weak and my voice is going down. Looks like I can't speak loudly.
How long is since you had this injection?
But they take about 10-15 minutes. And then
No, how long is it? When did you have this injection? How many days?
3rd of August.
3rd of August. Suppose that you want to ask some
you
questions?
said you still feel
Very weak. Very weak, and my voice is gone. Looks like I can't speak very good.
Usually, after a steroid injection, they do not last this long, and they will not cause any side effect to affect your voice.
Yes.
But you may feel weak because when you have the steroid injection, sometimes it can upset your diabetes condition or sugar control.
Mm-hmm.
That can affect many conditions you to have side effect associated with increased blood sugar levels. That need to address by checking the blood sugar.
Okay.
But steroid injection, I do not know where did they inject it. If it is into the shoulder, it does not cause any side effects as you described, apart from either infection or increased blood sugar levels can cause that feelings.
No, because they told me before they put the injection, they said it could be side effect. Then they said if you are agree, then we have to proceed to go.
Side effects such as feeling voice down will not happen due to the injection if steroids being put into a shoulder. But side effect feeling weak can happen due to upsetting your sugar levels.
Okay.
Blood sugar
And also
levels.
I'm feeling very thirsty, and also when I take the breath, I have feeling some problem also.
I think best advice I can give in this short terms to speak to your GP again and check your blood sugar levels and show
I check
them the
myself
shoulder.
regularly. It looks like sometimes 6.9 and 7.1 looks like this.
In that case, you need good to speak to GP to investigate further whether your blood levels are all right.
Okay. And what happened, now in the Albion hospital, private hospital, they give me another appointment. They said you can come to see us. And do you think I can go back again with them, or?
You should ask the doctor you should be able to now, 3rd of August, now this is 20, that's roughly about 2.5 weeks.
Yes.
Usually they will have a look about, depending on how busy they are, 6 to 10 weeks they will normally call you, but I can't comment on that. It depends on what their schedule is. Sometimes this type of symptoms can happen for a short period of time, then they will settle back up to about 6 weeks.
Okay. But nothing worry about, because I'm
That is, this type of conversation I can't come to a conclusion without looking at you. So that's why somebody need to look at the shoulder
okay.
and look at the bloods.
Yeah, because if I go there, it's very expensive. They charge me nearly 700-800 pounds.
That is the issue. Have you done it privately? Then you might be able to call them and get advice. But your GP should be able to check your blood and investigate your shoulder to find out if it's all right.
They can't do anything because of the lockdown. They can't see anyone. They only no face to face, only for video call or phone call.
Unfortunately, I also face with that type of situations. But you should be able to talk to the person who has done the injection, so they will explain a little bit more.
Okay.
Thank you very much.
Thank you very much.
Thank you very much.
Thank
It was a great pleasure having you here.
Thank you. Same to you, sir.
Hope
Thank you very much for your help.
It helped you. All right. Okay. Let's talk a little bit quick, and let's talk about what is it, somatic pain, and something is the emotional pain. So people feel emotion and they feel down and they feel pain.
Now we describe somatic pain as any pain which causes by destruction of your tissues, fracture bones or tissue damage. They always generate some degree of pain. We'll say appendicitis, tonsillitis, anything that is generated by the tissues.
So that must be, a lot of people must be weaving as the colloquial, the pain, isn't it?
Yes.
Like the real pain.
And then the somatic pain is something very interesting. That because, emotional pain. That because when you think about the emotions, emotion is a function of the brain. Now, if you look at the electricity generator, you got the generator machine. once it starts working, it generates electricity. That's the function of the electricity generator. Or if you think about the car, when you start, it starts working. So that's the function which causes by that engine is running. Likewise, emotion is generated by your working brain. Now, emotional pain is, we call it, you think, you feel pain due to some sort of abnormality or various pathological condition can cause you to think your pain. Not only that, it's not only thinking. And then you change your behavior according to your thinking. And you keep it to yourself, and you fall into vicious cycle, thinking again and again, causing more pain, but you feel more pain. And
so is this that your brain is thinking that you have pain and you feel pain? Is that right?
And not only that, you change your behavior pattern. That means, for example, we'll say you start feeling suddenly pain in the shoulder, or you thought that you have a shoulder pain. So behavioral change is, you think, if I move this elbow, you can have more pain. Because of that, what you tend to do, you make it fixed. Now that means it may be nothing wrong, but you think about the pain, you keep the elbow fixed. That is your behavior changes. So that you stop functioning the shoulder. But if you're going to keep that way, that elbow after a few weeks time, it will cause generally more pain because it's a non-functional status.
Okay.
Now these
so is that like if somebody had a little pain on the elbow and they don't move it and they leave it for a long time?
Not necessarily. They didn't have pain, but they thought that they have pain.
They thought that they
have pain. So that argument will say, you think you have pain in the legs, and you start limping because you're not using the leg, thinking that pain, that make the behavioral changes.
Is it normal for any adult, or is it like certain age or certain gender group, or is it?
Normally, it's called, when you have borderline mental disorders, these type of personalities or these type of people can feel this type of pain. And another things, normally if you have anxiety, if you have depression, if you can't sleep, remember I said, we have nerves, chemicals for you to feel pain. Because of that, why you are having borderline disorders, why you have anxiety, depression, all that thing, because there may be some chemicals are not right, not
chemicals,
correct.
Right.
In that situation, we'll say you can have a little pain, or this pain could be normal on day-to-day life you generate, but you start to feel more pain.
Feel it more. Right.
So it's a relaying mechanism, that connection to the brain may be broken, or the control or the brake which we normally put into the normal pain may have disappeared. So therefore that normal pain going to reach your brain. When you start feeling that pain, that's maybe normal pain to normal person, but that person who has such derangement or borderline disorders can feel that normal pain than you and me. So when that happens, they can change the lifestyle. Now that's a different category, but the emotional pain is one of the things which due to the function of the brain. Same thing apply. We'll say, if your loved ones, we'll say boyfriend and girlfriend, when they break apart, so that can cause emotional pain. Same thing apply. If you shout at loved ones, if that gets hurt, they may cry. Or if somebody dies which you love, that can cause emotional pain. That is completely different. But that is due to function of the brain. But now, where do you get this information? Not from touching on the body, but it gets from all our feelings. What we learned before, what we listen, what we see, all these still give you information in your brain. You accumulate them. That learn behavior during your life cycle modify you to understand current situation. For example, if somebody like loved one shouting at you, first thing you might cry. But because now you learn during your lifetime, second time when they shout, you might ignore them.
So it comes from one ear and goes from the other ear, is that right?
Exactly right.
Okay.
But that's why education is very important part on understanding how you react to this type of pain.
But then some pains are short-lived and some pain last longer. What are these
Now,
about?
normally we call acute and chronic pain.
Okay, right.
Now, acute pain is called, usually in the medical terms, if the pain lasts longer than 3 months, it is called chronic pain.
If it lasts more than 3 months,
3
it's
months called
chronic
chronic pain. Now, the acute pain is called due to acute damage on any tissue components that generate pain. That will, as you described at the start, they don't last beyond the healing process. That normally physiologically we say is up to 6 weeks.
So that's a good protective mechanism, isn't it? Probably we evolve with that.
That will it increase your awareness, consciousness, how to protect yourself.
Right.
But then acute pain and chronic pain are slightly different. But if you think about this, chronic pain sometimes can start today. But even though we describe pain lasting more than 3 months is chronic pain, but they have to start one point. But normal characteristic of this acute and chronic pain could be different. Normally, acute pain is very sharp. You can pinpoint. If you have a fracture, you know where the fracture is. You can say fracture is.
Oh, that's right.
If the tooth is aching, you know that the tooth is aching. So you can pinpoint most of the time, but sometimes it's difficult. In the tummy, it may be difficult, but in the many of the body organs, you can say. But when it comes to chronic pain, they're normally vague. They're normally dull. You might not be able to describe, but the way you describe to us, normal characteristic of pain is a description is difficult. When the description is difficult and you're trying to give a vague description of the pain, and also they come with some sort of abnormal sensation, like they are not quite sharp pain, but you may find abnormal sensations such as tingling, numbness, burning, or any dull ache, or feeling cold or hot. But that can divert us to understand, oh, this is not something acute. But in any case, if you feel acute or chronic pain, having advice will be very useful.
It's better to get advice.
That's correct.
Okay. What are the common types of pain you see in your clinic? What is most common in these days? We have people who's got pain all the time with a certain disease like fibromyalgia.
That's correct. This is very common. Now, for example, we'll say, if you look at the pain clinic, most of the patients come with back pain. If you look at the population-wise, 1 in 5 patients can have back pain at any given time. And if you look at the person, 80% of chance somebody may feel during their lifetime back pain. And if you look at the fibromyalgia, it's also common, but it is under, depending on where you're looking at it, under 5% of population can have pain. But when you have back pain, it could be 20%, and sometimes it could be more. But 80% of them have back pain. Now, when you think about the back pain, normally we describe back pain, if it is starting from here to at this level, lower rib of the back, and up to that, we call this is sacroiliac joint, or the joint in the pelvis, and up to here we call it back pain.
So that the lower part of
the spine. But when you think about that, when you think about back pain, many of the physicians, many of the normal human being, soon they start feeling back pain, they look at the spine. But
so it's not from the spine, it can be something else.
Now, if you think all this body is connected, now all body parts are connected. Now, as I said, if you get normal flu, you tend to get back pain due to muscle compartment at the front. If you get any abdominal discomfort, any gastritis, pancreatitis, appendicitis, you tend to get back pain.
You still get back pain, okay.
If you get IBS, you get back pain.
Back pain.
So there are a number of conditions which can cause back pain apart from the spine. Now, when we start feeling back pain, first we need to think and understand whether this is something dangerous or not, or whether this is completely different than actually your back. If you think about the back itself, we'll say everything is excluded. Now you think about the back. If you are a 40 years old man you can have this segment, which is the last segment of the spine, where the spinal bone connects to the sacrum. 50% chance you can have changes. When we look at ourselves, we get old. Now, because we get old, we see skin getting changed, hair getting gray. When that happens, we fail to understand our inside also getting old. Now, this spine.
Can you turn the spine towards the camera that way? The other way?
So the back.
So that's
This
better, yeah.
spine, these areas normally called discs in between bones, and also these are normal vertebral body or the backbones. They have a lot of joints. Now, because all this structure going to get changed, that is a normal process to mankind. We call it wear and tear, or changes with age, or degenerative changes. Unfortunately, some patients, these changes can cause pain, but not everyone. But why I say that, if you have these degenerative changes causing pain, then jumping into conclusion to do something in the spine, which is normal aging process, is not the ideal one. First, we need to exclude any other causes for back pain. Then we need to find out whether this is the normal process of aging. Then we need to find out whether there is anything we can do.
Okay. So when someone comes with back pain, so it's not always the problem in their bones itself.
Not necessarily.
Always have to look as in general as a patient, you know.
That's correct.
The stomach and everything else.
We in the pain clinic, we approach holistic approach to treat the pain patients. That means we understand, as we said, those previous we discussed all the other components which can affect your description of pain.
Yeah.
And also, only huge or only things which you need to worry when there are dangerous signs associated with the back pain. For example, if you feel perineum, which is this area, bottom, if you have any numbness around the perineum or the groin with back pain, but it has to be sudden onset. And also, if you have lump and a bump with severe temperature, or suddenly you notice you have shortened and cause severe pain, or you have an accident causing severe pain, or you feel sudden onset of back pain going down the leg, and also you feel tingling and numbness, or you suddenly get back pain, you start losing bowel and bladder control. Either you can't pass, or you don't feel that you have passed urine or bowel opened. When this type of scenarios, you need to urgently attend to the doctor, or you go to the A&E. But if those symptoms are not there, then you don't have to panic. Then you have to take things one thing at a time.
Okay. What is it sciatica? Does it relate
now,
to
we
that?
call sciatica. Sciatica can happen due to changes in your bone. Now, this is called sciatic nerve. Now, sciatic nerve is one of the major nerves which goes to the legs, and it started from number of branches from your spine. Remember, I said any degenerative changes can aggravate or irritate branches of these nerves. Now, any branches irritation of any branches of this nerve can cause pain going down the leg, which normal lay language it's called sciatica, because the nerve which goes down the leg is called sciatic nerve. But that's only one of the nerves. But remember, in normal human life, it doesn't happen all the time that way. So if this nerve gets severely compressed, then you get sharp shooting pain going down to the leg, causing numbness, could be sciatica. And also, if there are a lot of branches around it and they communicate each other. Because of that, any of the minor issues can cause pain going down the leg.
Any compression further up?
Or any compression further up, because there are communication, and also there are blood vessels. They all can affect sciatica. They can generate sciatic pain, or they can imitate like sciatic pain. Because of that, it's good to attend to a doctor. But if it is associated with the degenerative changes of your spine, Most of the time, we only can help them to manage the pain. You might not be able to get rid of the pain.
Get rid of the pain. Let's talk a little bit more about what kind of care we could give for this
Now,
pain, what kind of treatment and exercise and
in the back
you
pain,
suggest?
it's a good question, Akram. Now, because as soon as we talk about back and leg pain or the back pain, everybody jump into what we can do about it. First thing, we need to avoid it's happening. One of the main conditions why it happens, because on day-to-day life we forget about our back. We work, we go to normal day-to-day life, and then what we do is we use legs, arms, but we don't think about the back. We don't do exercise to your back. If you want to avoid it, when you don't have the back pain, then you should do your exercise. And you should have a healthy lifestyle. But once you have a back pain, many people trying to build up their back muscles when they start getting back pain.
Back pain already.
It may be too late.
Too late.
But what we advise them, self-care. If you have a normal pain associated with the degenerative changes, we normally advise rest, pace, and do exercise to your back, which is normally yoga, tai chi, pilates, or any other exercise which activate these muscles. And also, don't go to extreme like severe smoking or alcohol intake. And also, look after your weight. Many people ask, they smoke, how it can cause back pain.
That's what I was about to ask. Yes, they smoke, and how does it affect the back?
Now the question is, if you look at the packet of cigarette, it says smoking kills. Now how it kills, it either make a stroke or cause a heart attack. And the second thing is can cause lung cancer. Now the question is, if we think about the heart, little blood vessels get plaques. It increases the formation of plaque by smoking. Same thing will happen to the arteries which supplies the blood vessels to the discs and the bone. If you get blockage of arteries in your heart, same thing can happen here.
Okay.
And therefore, vital nutrition which you need to keep healthy bone will get affected by smoking. But some people may be lucky. But on top of that, if you don't do exercise, when we talk about the exercise, how exercise does, if you do back exercise, it improves the muscles. We normally explain to the patients, you move your muscles, it causes lotion of the muscles. So that movement causes lotion.
Movement causes lotion.
Lotion.
Okay.
That means you do passive movement to increase activity of the back muscles. That will increase the blood flow to the muscles. It will increase the blood flow to the nervous system. It will take away all the junk, unnecessary things, and also enhance the nutrition.
We talked about exercise for the back. Are there any websites people can watch and get some advice about what kind of exercise they could do?
Now, when you
the
think
back?
about the back pain, if you get a back pain, if you go to a website, they might ask you to do X, Y, and Z exercises. But what we advise, depending on your pain, depending on your personality, you do within your limit. Don't overdo them. That's why it's good to get advice from a specialist. So we normally advise to get a specialist physiotherapist. Now physiotherapy is also different. Now common understanding is that if you get a back pain, you go to physiotherapist, understanding is somebody should jump on the back and do massage or stretching. That's not what we are looking for here. If you want to improve your back, you have to do exercise for yourself. You have to identify what you can do, what you can't do. But if you go to normal Pilates or Tai Chi classes, they will tell you, looking at the common person who has health conscious, they are doing exercises to do exactly the way they are doing. But what we advise, not like that, we advise, find your limit. You don't have to bend the same way as someone else does it. You find your limit. But
that is important when you go to this Tai Chi
very
classes,
important.
You don't have to do exactly what everyone does it, but you do what you can do.
What you can do, and also we call it pacing. That means you don't have to do in one go, 1 hour or 2 hours.
Gradually you increase your strength.
rather than strength, your ability to do exercise.
Ability to do exercise.
So movement, when we say strength, think you are going to build up your muscle strength. That's the wrong thinking. What we need to do is need to keep passive movement to move your muscles, stretch your nerves, to keep functioning. And then if you feel good tomorrow, you can generally increase your time. There are so many websites, but you can look at the British Pain or the NHS website, which is a common advice will be given. But more of us, because you are a person, your pain is yours, someone else's pain is different. Therefore, you should get advice from qualified physiotherapists on that specialty to get best advice, to find out what you can do. And don't expect anyone else to do exercise for you. You have to do yourself.
So exercise you still have to do yourself.
That's correct.
Okay. Do we have any magic pills?
Now,
when I go to of course, if I go to a doctor, I would just want to go, and if it's private sector, I would pay him the money. Or if it's an NHS, I just want to say, oh, look, I have pain here. Give me a tablet and send me home.
now,
Do you have that magic tablet?
now, this is the thing. Remember, we discussed, briefly summarize, pain is very complex. It depends on many parameters. A common understanding is when the patient come to my clinic, they says, doctor, I have knee pain, I was given X tablet. It works for that, but it doesn't work for my shoulder or any other pain. But remember, when we taken a tablet, just go through the mouth. Once you swallow it, absorbs, it works everywhere. Some of the tablets works in the tissues, that means peripheral part of the body. Some of the tablets work in the nervous system. So when they do that, either they block pain coming to your brain, or they reduce you feeling pain. Now, depending on what they do, they act differently. And also remember, when we swallow a tablet, that is a one chemical. So every chemical in your body acts differently depending on where they are. Same chemical in your spinal cord, which is inside your spine, may act differently than what is same chemical in your brain.
In your brain.
But we only give you a chemical, similar like that one. When you swallow, it goes and acts everywhere. So in the brain and the spine. Therefore, there are no magic tablets. Depending on the type of tablet which we prescribe, sometimes we may have to combine everything together to improve the pain. But remember, any of those which we describe, exercises and so on, has no side effects. But
so the best thing is to avoid tablets
if you can.
And
then most of the tablets for long term, apart from paracetamol in high doses also can cause side effects, but most of the tablets can cause some degree of side effects for long term. In some tablets, they can cause short term side effects. Most of the tablets, when we swallow them, because they are chemicals, they act everywhere in your body.
There is no ideal tablet which does not give any side effect and just give the best pain relief.
And the other thing is, if you are taking the tablet, it's only what it does is reduce the pain. Now, what we are trying to do in the pain clinics, we are trying to avoid suffering of pain. All these tablets, what we are trying to do is educate you how you can modify your life to live in pain. What I mean is suffering. Do we have enough time?
We are almost done.
So suffering means, it's very important. Suffering means when you have especially chronic pain, where you live 24 hours a day at your home, you can't sleep because of the pain. You don't love your loved ones because of your pain. You don't go out because of your pain. You don't do any social activities because it disturbs your day-to-day life. That is suffering in pain.
Suffering in pain, okay.
So what we're trying to do is, we are going to take your suffering away. We will educate you to have a near normal life in the society. Remember, When you have chronic pain, you're never going back to normal, but you need to modify your lifestyle to live better.
Subodha, thank you very much. It was a great explanation about pain, and we had I think we were expecting much about pain, and probably people were expecting when you say pain that you have a magic tablet, but it's generally, as you said, it's the life, isn't it? We have to modify our life and adjust our life to the pain and learn to live with it, and probably that was the best advice.
That because it's not like any other disease. If you get a diabetes, you get a pill, it controls, you don't feel pain, but when the pain becomes chronic, it is a disease and you still feel pain, unfortunately.
Thank you very much. I wish we had more time, Subodha. It was a pleasure having you here.
Thank you very much.
We have explained certain amount of the pain. Pain is a big subject, and it will take days to explain about it. But anyway, if you have any more questions or any more suggestions, we can always email us on healthtalk@intv.co.uk or message us in Facebook or Twitter. We will respond to you as soon as possible. And of course, I can ask my guests, and they will be more than happy to reply for any of your questions. But since we don't have much time, unfortunately, we have to say goodbye, and look after yourselves, and we'll see you next time in a similar program. Thank you very much.